Hello and good evening, everyone. Welcome to 365 Live. My name is Gary and I'll be your host for tonight's live session. So, 365 Live is a platform where we educate the public on cancer and encourage a cancer prevention lifestyle. So, whenever you see this logo, you know that 365 Cancer Prevention Society is currently having a broadcast. Tonight's talk, Own Your Liver. Early Detection Saves Lives, is specially brought to you by Roche and Dr. Chen Kai Na, Associate Consultant of Gastroenterology and Hepatology at Singapore General Hospital. But before we begin that, a gentle reminder, all the information shared at this event by the speaker by 365 CPS are for general information only. It may be subject to changes, so please consult your doctor for your personalized, detailed medical advice. All right, so this is why we're here tonight. So I am pleased to introduce tonight's speaker, Dr. Chen Kai Na. She's an associate consultant of gastroenterology and hepatology at the Singapore General Hospital. She has a clinical interest in gastroenterology and hepatology, as well as diagnostic and therapeutic endoscopy. And because of that, she'll be sharing a very important topic tonight. Own your liver. I think that is a very, very important message. Own your liver. Early detection saves lives. And of course, as always, if you have any questions along the way, please do comment. So post it in the chat. We will definitely get to your questions during the Q&A time that we have set out for you. All right, and so with that, I would love to invite Dr. Chen on the screen right now. Thank you so much, Dr. Chen. I'm so glad you're here with us tonight and willing to share your knowledge.
Thank you so much, Gary. Hello, everyone. Good evening. I'm Dr. Chen from Singapore General Hospital. I would like to thank 365 Cancer Prevention Society for inviting me to give this talk. And it's an honor to be here on Facebook Live to share with you about liver health. Without further ado, I will start my presentation.
And just before you begin,
okay,
there was something that I had read. I don't know if everybody else knows this. How many functions or jobs does the liver actually do for our body every day? Like, I mean, are we talking like 1, 2, 3, 5? What's the estimate? Like the number of jobs that livers have to take?
Yeah, your liver is actually working very, very hard. Later, I will talk about the vital functions of liver and to give you an idea about how hard your liver has been working all these years.
Okay, so you're not going to give me a ballpark figure, roughly. Is it how many jobs? 1 job, 5 jobs? Is there a number to how many jobs the liver does, or are you going to keep us in suspense?
I will keep you in suspense, so talk to you later.
Okay. All right, well, I'm not going to interrupt any further. Start, because I want to know the answer to that question. All right, take it away.
Okay. I hope everyone can see the slides of today's outline of the talk. So I will talk about why is our liver so important, about the functions of the liver, what harms our liver, and what happens when the liver is damaged, and how to protect our liver. So first of all, why do we want to talk about liver health? Why is our liver so important? Liver is actually the second largest organ in our body, the first one being the skin. So our liver performs hundreds of critical jobs for our body every day. Just to name a few vital functions of the liver here. First of all, liver is a vital organ for body detoxification. We consume all sorts of stuff every day, including food, medications, supplements, herbal tea, etc. All of these went through our digestive tract and get absorbed into the bloodstream eventually. So when this blood that carries all this travel through the liver, it cleans our body by getting rid of the harmful molecules or waste that will eventually be excreted through our urine or feces. So our liver helps with this detoxification process. Secondly, our liver is also a metabolism hub, which breaks down proteins, carbohydrates, sugars, and fats into smaller molecules, so our body can make use of them to produce energy for the normal body functions. Thirdly, it helps to regulate the amount of fresh blood in our body by breaking down the old red blood cells and help us to replenish and refresh our blood. Lastly, it produces bile to help with digestion. Many patients may have the misconception that bile was produced by the gallbladder, but the truth is that the bile is produced by our liver, and it flows into the gallbladder as a storage site and being squeezed out by the gallbladder contraction when we eat a meal, especially a fatty meal, to help with the fatty food digestion. We can enjoy those yummy fried foods such as laksa or fatty meat dishes thanks to the bile that breaks down the fat so that we can digest them and use them for energy production by our body. And we cannot survive without our liver. It is also very forgiving. Our liver can regenerate to a certain capacity after damage. So what harms our liver? Now we know that our liver plays a vital role. The risk factors are very important so that we can avoid them to ensure we own our liver's health. The top killer is alcohol. Most people will agree with that. I often get questions from my patients. So how much alcohol is too much? Well, ideally, no alcohol at all would be great. Otherwise, there's a general guide on the amount of alcohol that likely will harm our liver. So for females, in general, drinking 20 grams of alcohol per day constitutes significant alcohol intake. If you look at the chart below, the alcohol units guide here, 20 grams is roughly a pint of cider that contains 5% of alcohol, or 2 shots of gin, rum, or vodka. So if a female on average drinks about 2 cans of beer with 4% alcohol every day, this already is more than 20 grams of alcohol and suggests significant alcohol intake. For males, 30 grams per day is significant, which is roughly about 3 cans of beer per day. And if you drink half a bottle of wine, or you share 1 bottle of wine with another person, 2 people share a full bottle, that's already above the threshold of significant alcohol intake. Of course, this is talking about daily drinking. And if a lady doubles the amount of alcohol that's set for the significant intake, she is at risk of alcoholic liver disease, where the function of the liver will likely be compromised and the pressure in the liver will become dangerously high. And if a man takes 6 units of alcohol per day, which is 3 pints of beer, he will be at risk of alcoholic liver disease as well. Remember, the important role of liver the important role of our liver is for our healthy body functions. So please be kind to our liver by reducing or stopping alcohol drinking. The second killer is viral hepatitis, especially hepatitis B and C, which cause chronic liver disease. Other known viruses, such as A and E, often causes acute liver inflammation rather than chronic disease, and most of the times people will recover from them. But hepatitis B and C can cause chronic inflammation and damages our liver in the long run. Hepatitis B infection is a major public health problem, and I will spend a bit of time on this. It's highly prevalent that more than 250 million people in the world are living with chronic hepatitis B infection. And every year, there's more than 1 million deaths from hepatitis B-related disease, such as liver cirrhosis and liver cancer. Hepatitis B virus has been around for a long time. Does everyone know this person in this picture? So this is Beethoven. He's our greatest musician of all time. So several locks of his hair has been preserved in the museum, and recently a group of scientists did a genomic analysis of the hair and found out actually Beethoven also had hepatitis B infection. And prior to his death, he suffered from liver cirrhosis and complications such as ascites in the last few years of his life, which were likely contributed by both the hepatitis B virus as well as alcohol, because he's known to be a heavy drinker as well. So Beethoven actually passed away from end-stage liver disease. So why do we always want to talk about hepatitis B in liver health talks? It's because Asia carries the highest burden of hepatitis B, and we're literally living in the endemic area. The highest prevalence is seen in China, South Korea, and Vietnam. And here we are, Singapore, where the prevalence is 3.6%, which is not low, which means about 1 in every 25 people among us might be a carrier of chronic hepatitis B virus, which might cause chronic liver disease. Hepatitis B virus can cause 2 forms of infection. It can also cause acute infection, like hepatitis A and E, which triggers our body's immune system to fight the viruses at a point of time. And it may give rise to infection symptoms such as joint pain, abdominal discomfort, or even jaundice, dark urine, and fatigue, poor appetite from this liver inflammation. But the good news is most of the time when people as healthy adult acquires hepatitis B virus in the acute setting, our immune system will take care of it and it will not cause the virus to stay in our body for long. But the other form of hepatitis B infection is chronic infection. This usually happens in patients who acquire the virus during birth, commonly mother-to-child transmission. And at the time, as a baby, without a mature immune system, they're not able to clear the viruses by its own immune system. So this form of infection will carry for life for this person. And it causes intermittent liver inflammation, which is very mild. It does not mount to any symptoms as described just now, like in acute infection, but it's silently damaging the liver over the years, and it can be lifelong. So when it damages the liver with repeated inflammation, it can lead to scar formation, which is also called fibrosis, and eventually leading to cirrhosis and liver cancer. Therefore, we call chronic hepatitis B a silent killer. So Hep B virus has a very high transmission rate, and it's transmitted through body fluids such as saliva, menstrual blood, vaginal and the semen fluids. Hep B is also spread by needle stick injury, tattoo, piercing, and unprotected sex that commonly happen for unvaccinated individuals. In endemic areas, most of the time it's transmitted from mother to child, as mentioned earlier. Hence, for pregnant women, testing hepatitis B status is very important. And if the mother happens to be a chronic hepatitis B carrier, treatment may be required to prevent transmission to the children. So in 2020, our Central Singapore General Hospital conducted a survey to the public and to evaluate the public awareness and knowledge regarding liver health in Singapore. Many respondents had the impression that hepatitis B is transmitted through raw seafood, mosquito bite, or sharing food, shaking hands, hugging, which are the common misconceptions for hepatitis B transmission. So the key messages here are, number one, if you're not sure about your hepatitis B status, test it. It is a simple blood test and it's quite cheap. It's included in many health screening packages, and it will give you information on, number one, whether you are silent Hep B carrier, or if not a carrier, whether you have adequate immunity against this hepatitis B virus. And if you don't have adequate immunity, vaccination should be recommended to you. Then the second message is if you know you have not tested Hep B for a while and perhaps your immunity has waned off over the years and you may not be immune right now, get vaccinations. It can be easily done in any GP clinics or polyclinics, which there are vaccination clinics as well. And for all the patients who are hepatitis B carrier, chronic carriers, please seek healthcare advice on treatment requirement. Not all the patients will require treatment. It depends on the viral amount in the body and as well as the liver disease status. And the liver cancer screening is usually required for patients who are hepatitis B carrier, regardless of liver damage status. Okay, a quick slide on hepatitis C. It is less common in Singapore. Overall, 0.5% of the population have hepatitis C and are carriers. Most patients acquire silent chronic infection, which is similar to hepatitis B. As high as 50% of the Hep C carriers are unaware they are infected. The route of transmission is similar to hepatitis B as well. It is through body fluid. There's no vaccination available for hepatitis C, but it is curable if for carriers of this virus, just with oral medications, which are highly efficacious at this point of time. So the key is still to test yourself for hepatitis C as well, which is available in most of the screening packages too. In case it becomes positive, oral medication, 8 to 12 weeks, usually will very highly likely to cure the disease. The next very big silent killer to our liver is fatty liver disease. Fatty liver can be contributed by excessive alcohol ingestion, as mentioned earlier, but increasingly we are seeing more non-alcoholic fatty liver patients who are usually diagnosed incidentally from screening blood tests or scans. Majority of these patients also had a number of conditions that are termed metabolic dysfunction, such as shown here, diabetes, high cholesterol, high blood pressure, obesity, which are all closely related to sedentary lifestyle and unhealthy eating habits. In patients who have fatty liver, screening for these metabolic conditions are recommended, such as diabetes screening, high cholesterol screening, and sleep apnea screening as well. Accurate assessment of alcohol intake and alcohol cessation counseling are also important, as fatty liver can be reversed if it is from alcohol. Stopping alcohol will reverse alcoholic-related fatty liver disease. So many of the audience may have heard that the number of fatty liver is on the rise, especially the type of non-alcoholic fatty liver. Just to show everyone the scale of the problem from this map and the statistics in the literature, in Asia, the prevalence of non-alcoholic fatty liver in general is 30%. That means 1 in 3 people. In Singapore, this number is around 40 to 43%, as you can see from the map here. So we did a study on all the SingHealth Polyclinic patients a few years ago and found out that for Singaporeans diagnosed with diabetes, the prevalence of fatty liver is staggering at 78.7%, which is almost 80% of the diabetes patients have fatty liver disease. So what does this mean? Given the very high prevalence of diabetes in Singapore, it means that based on the current trajectory, by the end of year 2030, or 5 to 6 years from now on, the number of patients suffer from liver cancer, liver failure, and liver-related deaths will increase 2 to 3 folds. So how does fatty liver affect our liver health and lead to serious liver disease? So this diagram is very important to understand this pathophysiology. So healthy liver contains less than 5% of fat. When the fat contains increase to more than 5%, it is called fatty liver. Not all the patients with non-alcoholic fatty liver disease or metabolic dysfunction associated fatty liver disease will progress to liver cirrhosis or liver cancer. In fact, most of the patients would remain at a stage of simple fatty liver without any active inflammation or scar formation in the liver. But NASH or steatohepatitis is a term to describe active inflammation and liver cell injury as a consequence of fatty liver. As we can see in this diagram, simple fatty liver and liver inflammation are in fact reversible with lifestyle changes and specifically weight loss management. However, once a patient starts to develop repeated cycles of inflammation and repairing of the liver injury, it will eventually lead to scar formation or fibrosis and later on liver cirrhosis. So this is a very slow and silent process. Patients are usually completely asymptomatic. They are not aware of this happening in their body at all. So we generally classify the patients of scarring tissue in the liver into 4 stages, F1 to F4. The progression of fibrosis is a very long process and a slow process. Roughly every 7 years, we'll progress 1 stage. But by the time of F4 disease, the liver is already in the cirrhotic form, which is hardened liver due to scars and nodules formation as shown in this picture here. Many patients are not aware of fatty liver disease, are not able to feel anything until the liver becomes cirrhotic and develops subsequent complications such as liver failure and liver cancer. So how do doctors know which fatty liver patients are at the simple fatty liver stage and which patient is progressing towards liver cirrhosis? Well, the easier way is to do some form of blood tests. There are many scoring systems allow a primary care doctor to assess the severity of liver disease based on the blood tests. But there's a limitation of blood tests because it can only roughly tell us how high the risk the patient is at for progressing into liver fibrosis or liver cirrhosis, but it's not so accurate. A lot of times these patients who are having an intermediate to higher score based on the blood test alone will have to be referred to a specialist clinic. So what do we do in the specialist clinic? One of the commonly used tool is FibroScan. So what does FibroScan do? It tells us which stage of fibrosis a patient might be at. Is it F1, F2, F3, or F4. So if a patient is in F1, then we'll tell the patients, good news, the liver is not too much damaged. Please lose weight and watch your diet, have a healthy lifestyle so that the fat can be completely reversed if it's successful. However, for patients who's in F3 stage and above, F3 or F4 stage, further surveillance and monitoring will be required as these patients have a much higher risk of liver-related complications. And a smaller proportion of the fatty liver patients develop liver cancer. And this liver cancer development does not necessarily happen in liver cirrhosis patients. It can happen directly from, let's say, NASH or steatohepatitis or active inflammation of the liver from fatty liver disease. Unfortunately, what has been very frustrating to the doctors is the fact that we still do not have a very good idea which patients will develop liver inflammation or cirrhosis or liver cancer, and who will stay in the state of simple fatty liver without any progression. We do need to do more research to gather more information on this very heterogeneous disease, and we need help from everyone, including the general public, to participate in such research to help us inform the best management of patients with fatty liver disease. So now you may wonder how to reverse the fatty liver disease. The proven treatment is in fact weight loss. A weight reduction of 3 to 5% will improve fatty liver and reduce fat in the liver cells. And a weight reduction of more than 10% improves liver inflammation and fibrosis. Some researchers also found drinking coffee might be beneficial in preventing fatty liver and fibrosis. However, you generally need to drink more than 3 cups, and this is a black coffee, no sugar, no milk. But don't get me wrong, so this is not a proven treatment for fatty liver or proven prevention measures. And of course, different people have different threshold to caffeine as well. It may cause discomfort if someone drinks more than 3 cups per day. So hence my advice is to drink coffee with moderation. And if you like to drink coffee, try to drink black coffee without sugar and milk to reduce unnecessary calories. Okay, the last risk factor I want to touch on is drugs or toxins. We talk about liver as a major detoxification organ just now, and such drugs and toxins go through the liver before being excreted from the body. Common drugs that's associated with liver inflammation such as paracetamol or Panadol, but it must be ingested with a large amount, not the prescription that's given by your GP or your doctors, which is usually a low dose to help with pain. So in people who, for example, suicidal attempt or taking paracetamol in bottles, those are the ones who likely have liver injury from Paracet. And certain anti-inflammatory drugs, such as NSAIDs like diclofenac, can cause liver inflammation as well. Antibiotics such as Augmentin and even anabolic steroids also can cause liver injury. So these drugs may cause liver inflammation, but the good news is most of the time it's transient, meaning that it's not long-lasting liver injury. It is reversible after finishing the course of treatment and your liver start to regenerate or try to detoxify by itself. And they do not cause long-term liver health problems. However, certain herbal remedies or traditional medicine, traditional Chinese medicine or health supplements may contain components that cause very serious harm to the liver, leading to liver failure, even requiring liver transplantation, especially in those who already had the chronic liver disease such as fatty liver or hepatitis B. We do not know which particular herbal component that causes serious liver damage at this point, but some of the TCMs are summarized in this table that may perhaps cause liver injury, but this is not 100% verified. As you can imagine, it's not easy to do studies to verify all these components of the herbs to find out which one causes serious liver damage. And in fact, also maybe individualized. If both of us take a same medication, the effect on you may be very different from the effect on me as well. So common example is a certain health product introduced by your family or friends who claim to have health benefits, but this may not be suitable for you. It may be suitable for your family or friends who is who is trying to help by introducing this to you, but it may not necessarily be suitable to you, and it may cause unpredictable effect to your body as well. So be very vigilant about such health products, especially when the exact component may not be readily available in the package. Okay, so now we move on to what happened to the liver when it's seriously injured or damaged after long period of exposure to insults, be it alcohol or viral infection or fatty liver. So here in the slide actually summarizes the complications of liver cirrhosis and signs of deterioration of liver function. The left upper corner is what we call variceal bleeding. It's presented as vomiting blood and usually large amount of blood or blackish vomitus. This is due to the rupture of blood vessels in the food pipe, which is esophagus. The reason it is ruptured is because the pressure in the blood vessel is very high as a consequence of high liver pressure from hardened liver, or what we call portal hypertension. Urgent scope is required to stop bleeding, and it is a sign of liver decompensation. The right upper corner is jaundice. It's similar to neonatal jaundice or newborn jaundice patients who present with yellowing of the eyes and the skins. The urine color in jaundice patients can be quite dark and classically described as Chinese tea color. We talk about liver as a metabolism hub. The development of jaundice is a sign of inadequate liver metabolism and poor liver function. The left lower corner is ascites. It is accumulation of fluid in the abdominal cavity. This is due to high liver pressure as well and poor liver function. Many patients with cirrhosis develop recurrent ascites down the road, which suggests a much shorter lifespan due to a very significant liver impairment. Hepatic encephalopathy, the lower part of the diagram, although the picture, is an altered mental status due to toxin accumulation in the body that affect the brain cells. It usually happens in patients with end-stage liver disease as well. And last but not least, the liver cancer. 1 in 3 cirrhosis patients will develop liver cancer in their lifetime. So there's a significant burden of liver cancer as we see more and more chronic liver disease from fatty liver and viral hepatitis. So now I'd like to talk a bit more about liver cancer. Not all the cancers are the same. Some have relatively good outcomes and some don't. The fearful thing about liver cancer is that it is one of those cancers with very poor prognosis. And this is contributed by the silent nature of liver disease progression, leading to liver cancer diagnosed at a relatively late stage. It is one of the cancers with the highest mortality in the world. Based on the local data from the Comprehensive Liver Cancer Clinic in National Cancer Center, Singapore, upon diagnosis, 46% of patients already had locally advanced disease, which means the cancer has invaded into adjacent blood vessels or lymphatics. 33% already had cancer spread to other parts of the organ, which is the end stage of cancer. So overall, only less than 20% of patients with liver cancer can survive more than 5 years after diagnosis because of this. The map on the right shows the incidence and death rates of liver cancer in the world, and the countries in the box, mainly Asian countries again, suffer a high incidence and mortality of liver cancer. Asia houses the highest burden of liver cancer in the world, partially because of the high incidence of viral hepatitis as well that I showed you earlier, which is a significant risk factor for liver cancer. So who will develop liver cancer? As mentioned earlier, 1 in 3 liver cirrhosis patients will develop liver cancer in their lifetime, and 90% of patients with liver cancer have underlying liver cirrhosis. Earlier, we talked about factors that harm our liver. Among those 4, fatty liver and the hepatitis B can develop liver cancer directly without even the development of cirrhosis. But due to the high risk of liver cancer development in hepatitis B, especially when patients who are not on treatment with high numbers of viruses in the blood, an active surveillance program is highly recommended by the international medical community to improve early diagnosis of liver cancer. And this surveillance program includes every 6 months of ultrasound and blood tests to detect liver cancer at an early stage. The frustration comes from the group of patients with fatty liver. Again, it is a huge group. High proportion of the patients will be fine without any progression, without liver cirrhosis and liver cancer at all. But a small proportion of patients will develop cancer, and due to this huge population of fatty liver patients, the absolute number of fatty liver patients with liver cancer is going to be very high in the future. At the moment, we still do not have a liver cancer screening program for the fatty liver patients yet. Earlier, we talked about the 4 fibrosis stages of fatty liver, and most of specialists will decide to start liver cancer screening for fatty liver patients with F3 and above liver fibrosis, so that we can pick up liver cancer in the earlier stage. So again, proactive screening of liver disease or regular health screening that could potentially pick up fatty liver disease will be the first step for our community to improve the care of these patients. What can we do to protect our liver? Again, early detection is the key. Most of health screening packages include blood tests for viral hepatitis and diabetes, cholesterol panels, and liver function tests. These are very helpful and may be the first signal for a seemingly very well patient to be aware of their liver health status. Patients who had abnormal results will be referred to see a specialist for further assessment on treatment requirement for viral hepatitis, for example, in patients who are carriers of viral hepatitis, and assessment of fibrosis stages with a FibroScan for fatty liver patients. Patients who have a very high risk of liver cancer will need to be monitored and initiate an ATC surveillance program or liver cancer screening program with blood tests and the 6-monthly ultrasound. These tests are simple to do to the big population of patients who are at risk of liver cancer, but they are not perfect. You can only pick up early liver cancer in 64% of the cases, but it is better than nothing, better than not knowing anything. So clinician researchers have been actively trying to improve this screening program with better results, such as this Elegance program has been on the news in the last few years, who will recruit patients with the risk factors of liver cancer and study their blood, urine, and stool samples. And hopefully one day we'll be able to find a better test for liver cancer, an easy and cheap test that can pick up liver cancer early in the patients with chronic liver disease. Secondly, we need to protect ourselves from exposures that can harm our liver. For healthy patients without any known liver disease, ensure vaccination is up to date. Both hepatitis A and B have effective vaccines, and they are readily available in many places. For patients who are hepatitis B and C carriers, please seek healthcare advice on the necessity to start treatment to suppress the viruses. There are many different types of anti-hepatitis B medications. At the moment, these medications only suppresses the virus growth, but with good efficacy. However, they do not really cure or eliminate the hepatitis B virus from your body, which means it will grow back when the medication is stopped. Such medications will usually require long-term or lifelong treatment in hepatitis B carriers. All the Hep B carriers also should be on liver cancer screening, as I repeat myself again and again. You need to start liver cancer screening every 6 months, ultrasound and blood tests, regardless whether you're on treatment or not on treatment for the hepatitis B. If you remember the 2 maps I showed you earlier, the regions with high prevalence of hepatitis B also have very high incidence and mortality of liver cancer as well. For patients who are alcohol drinkers, reduce alcohol intake or even stop completely. That would be great to reduce risk of serious liver disease. And what else can help with the fatty liver? Weight loss is the key, whether it's from exercise or from dietary modification. The aim is to achieve a caloric deficit and not to increase the fat content in the liver anymore. Adequate management of the underlying metabolic diseases, such as diabetes and high cholesterol management, are also very important in managing fatty liver disease. So I like to tell my patients that to achieve a weight loss, especially in patients who are middle ages or 50s, that perhaps doing exercise may not be suitable for all of them. So exercise only helps 20% of the time, but diet restriction helps 80%. So limit carbohydrates and saturated fat intake will be very important to achieve the first step of weight loss. Okay, now it comes to my last slide. October is the Liver Cancer Awareness Month. This figure summarizes the things we can do to prevent liver cancer and help with our liver health in general. I've talked about all these options just now. And with this, I will end my presentation.
Thank you so much, Dr. Kaina. Now, that was very, very useful information, and we do have a few questions here as well. And yes, I'm so glad that you jumped right into telling us about the many things that the liver does right from the get-go. What can I ask the first question? What is probably the most important function of the liver?
I would say the most important function is detoxification. Well, I wouldn't say most important because metabolism is also very important because we need that to for our body energy, for the cells growth in other parts of the body as well. So in fact, our liver really has many different vital functions. So the most important, I would say, is metabolism as well as detoxification.
Detoxification. So one of our audience members, Magdalene, actually commented right at the start. I'm guessing when we were talking about functions of the liver, she actually wrote detoxification. So well done, Magdalene, as well. We had a few questions. The first one was actually regarding apple cider, because you talked about alcohol again right near the beginning of your session. And Jesse was asking, is apple cider considered one of the alcoholic beverages?
Oh, okay. I believe there are different types of apple ciders on the market, but Gary, is it possible for me to bring back my slides?
Yes, sure is. It's coming very soon.
Okay, you can see here. So apple cider, it depends on the brand and the type you're taking. So the cider I'm talking about here contains 5% of alcohol. And yeah, with apple cider with 5% alcohol usually carries about 2.8 units of alcohol, which is about almost 20 grams. So that's why I say if you drink apple cider, if you drink it every day, then that is constitutes to significant alcohol intake. So you take it once in a while, it's still okay. When we talk about 20 gram and all that, this threshold is for daily intake that will cause significant damage to the liver.
Yeah, that's right. And if I may just throw in a little comment there, yes, you're exactly right. From my understanding of apple cider vinegar, there are different types. And so if it's like fresh apple cider that hasn't fermented yet and alcohol hasn't kind of come in, then the fresh ones, if you make your own apple cider, that shouldn't have any alcohol. But of course, the ones that you buy from the store in the bottles, they've already been fermented and they're usually sold as a liquor, right? It's usually sold as an alcoholic beverage. And again, if you just look at the label, all alcoholic beverages need to state the percentage of alcohol in them too. So that's a very clear way to know.
Yeah, you're absolutely correct, Gary.
I try my best. Okay, so we do have another question, and there was a question here. It came at about the time when you were showing the slides of liver cancer being not very treatable. I think it was about that time because there's a question by Tan Gyok Hyung, if I pronounce your name correctly, about what is the main reason. I think that question came in about the time when you were saying that liver cancer was, you said only 20% survived for 5 years or something like that. If I'm wrong, Tan Gyok Hong, can you please just reiterate your question again in the comments? But do you mind answering my question? Is what's the main reason for Asia having such a high incidence of liver cancer, and why is it such a low survival rate?
Okay, that's a very good question. So number one, I will answer why we are in the endemic region of liver cancer. So the reason is that traditionally Asians is an endemic area of hepatitis B, and hepatitis B is a significant risk factor for liver cancer. And hepatitis B being a very silent disease, and you don't feel anything. And the carriers, a lot of them do not even are not even aware they are hepatitis B carriers. So by the time the liver have problem, be it a cancer or liver cirrhosis, the disease has progressed for many, many, many years. So we do see patients coming in the first time seeing a doctor in their life. They have cancers everywhere in the body, right? So the reason is it's a silent killer to the liver, the hepatitis B virus, similar to fatty liver as well. And when it's silent, patients usually do not feel anything. They feel completely fine. And by the time they feel unwell and presented to see a doctor, the disease has already progressed to a certain degree. Therefore, what we say is detection was late, or rather, the pickup of the cancer was late stage. Of course, if the cancer is picked up at late stage, the treatment options are very limited compared to its capture in the early stage, where it is only inside the liver, a small nodule, a few centimeters only. Surgery or other treatment options such as burning, there are many options are available to even cure this liver cancer. But most of times when people are not aware of their chronic liver disease status, when they have certain symptoms are presented, it's usually late and we can't really accurately pick up at early stage. So that is the reason why liver cancer prognosis is very poor, or we say the outcomes are poor. It's mainly because we can't detect them efficiently at the early stage. I hope that answers the question.
Yeah,
Yeah.
I remember you saying that.
Yeah.
Oh, please.
Oh, yeah. But if you already know you have a chronic liver disease and you're seeing a doctor, the doctor will make sure you're on this liver cancer screening program so that we don't miss early stage cancer. Therefore, the cure rate is much higher. Yeah.
Yeah. So, and so, yeah, Magdalene had a similar question as well. And so I just wanted to reiterate that, yeah, for, what you mentioned earlier is that, some people have hepatitis, they don't know, right? And the different types of hepatitis, and sometimes it's silent. And so that kind of festers there. And I say this to some of my clients as well in my job, is that when we develop a condition, a disease, a lot of the time it is silent, which is what you're saying with fatty liver too. We don't really feel our liver getting fat. And because we don't feel it, we probably don't check it. If we don't check it, we don't know. If we don't know, and it progresses into those stages that she had on the images before, where the fatty liver turns into cirrhosis, then that becomes the issue. So the follow-up question to that was the testing. I mean, so we have screenings, and for 365 CPS, we're also offering a liver screening test for our clients as well, because again, this early detection is very valuable. So the question actually is, well, periodic checkups at the polyclinic, do they actually test for the hepatitis, or do those routine blood tests check for fatty liver, or are they something you have to add on and ask for?
That's a very, very good question. Okay, that's a very good question, because many patients also have the same questions, and when they know about the liver disease, the first thing they told me, I've been seeing polyclinics in the last 5 years. I don't know about this at all. Yes, this is a very common scenario in my clinic consults. So polyclinics will follow a patient based on the condition. For example, if a patient is diabetes, the polyclinics will able to do all the screenings necessary that's around diabetes conditions. For example, the test of the food, test of the eyes, and all this, they will do a very good job. And if you're following out with hypertension, they will give medicine to hypertension and all that. But if you don't actively ask for liver viruses screening, for example, they may not necessarily do it. Because, well, most of times the polyclinics are overloaded with all the patients with chronic diseases. They're not really catered to just screening the healthy patients, right? Healthy populations. So they're mainly catered for patients with chronic disease and manage them in the community setting. So, but there is increasing awareness that, as I showed in earlier one of my study, that diabetes patients have a very, very high prevalence of fatty liver. So the polyclinics doctors are aware of this. So many times, if the patients have metabolic risk factors, they will do periodic liver check, but a very simple type of a blood test, not a comprehensive one, right? But the aim is mainly to pick up it early as well and refer to specialists as necessary. So there is an increasing awareness of this condition, and I believe most of polyclinic doctors are aware of this as well. So if you truly have risk factors for fatty liver, they are going to do periodic check. But it is not the comprehensive screening that we talk about just now in the talk, not the hepatitis B and all that screening, which usually happens in healthy screening packages. Yeah.
Yeah. So, okay. So with that said, then what I interpret that to be, if, and please correct me if I'm wrong, is take care of your liver before you need to even do a test. I mean, Dr. Kaina has already shared with us, things about being, having that healthy lifestyle and sort of watching your diet, and overweight is a risk factor for all of these metabolic diseases, and overweight is the risk factor for fatty liver. So if we can manage the weight, then, well, we could prevent all of this from even happening and not even needing to request these blood tests. There was a question
Very well said,
about,
yeah.
Is that right?
Perfect.
Awesome. Because there was a question, and I just want to quickly reiterate for Magdalene, because there was this question about what are the usual symptoms, and as Dr. Kaina said, there's no symptoms, right? There's no usual symptoms for fatty liver, and it's only when we get diagnosed with it, if something has fallen apart or something is wrong, that's when we get the symptoms, but that's already later stage. It's not right at the start. But then on the fatty liver, somebody did ask, so Fu Mingyo asked, do you guys actually, are you able to quantify the amount of fat in the liver? And is it, what's the serious? I think you had the numbers there. You might want to bring that slide back up. You had the numbers there, I think, in your slide. Is it possible to actually reverse to zero? Like, I have seen some of my clients reverse their fatty livers, and I've seen the blood tests and things for that, but I want to, we want to hear from you as well.
Yeah, so that's a very good question.
Reverse it.
Sorry, yeah, okay. Yes, so two questions here. Number one, how to quantify the amount of fat. Number two is whether it's possible to reverse it to zero. So how to quantify, there are different types of tests that can quantify it. The FibroScan I talk about, I focus on the fibrosis, which is more important in terms of scar formation, but a FibroScan also can give a number in terms of fat quantity, okay? There's no a number to say 5%, 6%, 7%. It's not a number like that. It's a number that's from the machine. And based on a number, your doctor will be able to interpret for you how bad your fatty liver is, okay, based on that number. And of course, there are other tests as well, such as MRI, can quantify the amount of fat in the liver as well. But not all the MRIs are same. If you're doing MRI for your spine, for example, it doesn't quantify the fat in the liver. You have to do a dedicated liver fat scan to be able to do that. Okay, a blood test doesn't tell you the amount of fat. Okay, so only scans at the moment, and special scans that usually done in the hospital, not in the normal GP clinics. So is it possible to reverse amount to zero? Well, as we don't know the quantification, so we can't say it's 100% zero, but as long as it's less than 5%, most of the times you scan, for example, simple ultrasound will not see much of fat inside. So to reverse the amount of fat, is just need to reverse it to a threshold that is not going to damage your liver. So this threshold had traditionally been set as 5%. So how do people set this 5%? Is by taking tissues from liver. And that's how we have learned about fatty liver disease in the past. Now it is not a thing we do commonly for our patients to take sample from the liver, but maybe just a couple or maybe 5 years ago, we have been doing that for our patients to quantify number of fat. But of course, it's an invasive test and it's painful. So now we are using scans as surrogate to do that, and it can help us to quantify the fat and help us to tell you whether your fatty liver has been reversed or not.
Yeah, and yeah, that's right. And I'm so glad that you said that as well, that, it's whether it's to zero or not, I don't think it's to zero. And one of the reasons why is, if you understand biology, the liver stores fat anyway. So I don't know whether that's going to be part of this percentage that you're talking about, but the liver actually has fat storage inside. So,
well, liver does the metabolism of fat.
Yes, that's a matter. Yes.
Yes,
but that's
the
different to
metabolism
this fat, right? Is that right?
Yes, this is different. Okay. This is the fat in the liver cells. Under the microscopy, the pathologist can see the fat lobules. That means white color bubbles inside the liver cells. Those are unhealthy fat, which is the fatty liver fat. It is not the fat that's being processed by the liver to help with the metabolism. Yeah.
Awesome. There's another question about ultrasounds, actually. You mentioned the word ultrasound to scan the liver for the fat. So there's another question about ultrasound saying, if cysts were found in the liver, would that lead to cancer?
Okay, that's a very good question. Cysts are very common. So cysts are basically water bubbles. Okay, you can imagine it's a bag of water inside, and in the liver, the color will look. This bag of water will look a very different color from the blood, for example. Therefore, the scan will be able to see that and pick it up. So liver cysts are common. Majority of the time, I would say 95 or even higher than that, they're benign, meaning they will never become cancer. They will just stay in the liver. They will not disappear. They will not disappear either. They will just stay there. It can grow a little bit, getting a little bigger and getting a bit smaller later on, it depending how the person did the ultrasound and pick it up. So the short answer is no, usually simple liver cysts do not lead to liver cancer eventually. But it's important for the doctor to interpret to you whether the cyst is a simple one. There are cases, rare cases of complex liver cysts, which turn out to be something bad. But those are very, very rare situations, and the scan usually can pick them up quite readily. So ask your doctors about the cysts and show them the scan, so they'll be able to tell you whether it's simple cysts that you don't need to worry about.
Mm. And also just on that, and because you said exactly, ask your doctor about that too. Do remember that these sessions are for information only. So I do see a few questions there that are a little personal with test results or with requesting for liver screenings. These sorts of things we don't really want to discuss here because it's at a disadvantage for you and for Dr. Kainar because she doesn't know you. She doesn't know your history. She doesn't understand you as a human being and all the other lab tests or all the other things that is required to be able to provide personalized and accurate information, especially because it's so specific. So I do apologize. I won't be asking these questions to Dr. Kainar, these ones that are very specific to the individual itself. Okay, please do follow up with your own treating physician to get the right medical advice. But that being said, if you do want to see Dr. Kainar, I did see a question about that. Where is your clinic, or where are you based? Or yeah, if somebody did need to come and see you or wanted to do a more comprehensive screening or tests, where do they find you?
I'm in Singapore General Hospital.
Okay.
So it's a department of gastroenterology and hepatology. I do run clinics 3 times of the week. So you can find my profile on the hospital website.
Okay, so they can call the hospital and
Yeah.
request for an appointment with you, and they will handle the booking. Is that right? And they will get a chance
Yes, that's right.
to speak
Yeah.
to you. Okay, perfect. So if you do have specific questions, please do go and look for Dr. Kainar or your own treating physician if you already have a doctor,
Yeah.
because
Yeah.
they would be the best people to speak to. But of course, not in a public forum, but in a private setting where they can go through a lot of your detailed medical history and current history as well. Okay. Are there any other questions? I did. Let me just have a quick look. If there are any questions that I did miss. Is fatty? Oh yeah, is fatty liver genetic? Or is it a transmitted disease? And can I just throw in my 2 cents there? If we can reverse it through diet and exercise, I think we have more control. And this is, I have to say this because I love hosting these sessions because the people that are listening and are tuning in, that are taking these gems, these nuggets of advice from all of our specialists here, we're taking this because we want to take control of our health. We want to take charge of our health. I mean, the title of tonight's session is Own Your Liver. I think that's amazing. We can take ownership. And the moment that we go genetics, it's like we have zero control. And right now, let's say, yeah, Dr. Kainar's like, own your liver, guys, own it. It's yours. So I just wanted to stress this point because we are here because we want to share these information with you, that you can take ownership, that you can take your power back. Because when it's genetics, we kind of go, well, my parents have it. I can't do anything about it. And I truly believe, and based on what I've just heard now, and I've hosted actually another liver, so this is like a refresher to me. We've had a different sort of liver cancer session before, and the message was the same. There are things that we can take charge of, right? And like hepatitis C is curable. We can do something about that. We can take charge of that as well. But you know what? Enough of me. I just want to promote proactive health. That's where I come from. But please, Dr. Kaina, correct me if I'm
Thank
wrong.
you, Gary.
And is this a
Thank you, Gary. Yeah.
genetic disease?
Okay, so fatty liver, it's a complex disease. So a lot of this is related to metabolism in your body, right? So metabolic dysfunction, similar to diabetes, obesity, and all that. But comes also with the complexity of it can be affected by certain genetic polymorphism, what we call. But these are not to say that you can't do anything about it, exactly as what Gary has said. It just means perhaps compared to your friend, you're more likely to develop fatty liver disease than her. Or your parents may have had fatty liver disease as well. Then you find out you had fatty liver at a bit earlier age compared to other people. But this can still be managed with lifestyle, weight loss, and to reverse the fat as well. Of course, it's complicated, it's complex. So exactly as what Gary said, we do what we can to help with our liver. For those who's out of control, let your doctor take care of it. They will try to make sure that you at least to monitor you closely and to not develop any bad consequences from this. I can say that, yeah.
Yeah.
And liver cancer similarly.
And you know what?
All right.
Dr. Chen is the best doctor I have visited. That was from one of our listeners here, Lui Fang Ying. So there you have it. Exactly, she said. We take charge of what we can, and what we can't, we let go and let God and let the doctors and whoever that you're helping, or that you are trusting, I should say, not helping, whoever that you're trusting to do their best work as well. So yes.
Thank you very much.
And yeah, so that's a fantastic testament there. And for the person who's asking for Dr. Kaina's number, I'm so sorry, I do not have it. I'm not able to give it to you. But if you do call Singapore General Hospital and you request request for an appointment with Dr. Chen, she will be able to see you there at Singapore General Hospital. That's where she is based. All right, we're going to wrap up soon. We do have one last question I would love for you to answer if we have one more minute. Is that okay? One last question?
Yep.
Cool. How can we detox our liver, and how can we improve fatty liver condition? I think that's a great. How do we detox? How do we help our liver?
Okay, that's a very good question. Your liver does the detoxification. You don't need to help the liver to do the detoxification. But what you can do is to make sure the liver is healthy enough to do this job for you. So how do we make sure our liver is healthy enough to do the job? Don't drink alcohol, weight loss, no fatty liver, check your liver, check your blood test for viruses in the liver, and all these what I've talked about are important things to make sure your liver is as healthy as possible and prevent it to acquire diseases. So I think let the liver do its job. He has a lot of job to do, and he has done an excellent job already. But make sure your liver is healthy enough to do this job for you. Yeah.
So I have a question then. You said something right at the start of the answer to that question. You said the liver does the detox. We can't do it for. Does that mean that every liver detox program out there? There's so many liver detox programs out. What does that mean?
That's a great question. This is the question I don't have an answer for.
Yeah. I'm just kidding. There's a lot out there, and then you just said, help the liver detox, but can we detox the liver so we can detox?
Yeah, I'm not exactly sure all those detox program, but what I believe is they actually try to help to minimize the liver inflammation, for example. That's one of the things perhaps they're doing. But to be very honest, I don't know. I don't know how they do it, and maybe perhaps they have the reasons how they can do it. I'm just not very aware of it because
Yeah.
I practice medicine. It's not part of medicine. It's perhaps part of the supplements health. Yeah.
But I
So
will
unfortunately, I don't
just
have the
say
answer.
one. I'm sure a lot of them work. I've definitely heard of some testimonials of friends and people that I know that say, oh, this liver detox was great. But I will have one little bit of caution, which is what Dr. Kainar said. The toxins and the drugs that we take. I mean, don't even talk about toxins. Just like the foods that we eat or alcohol that we eat, our liver has to process all of that stuff. Okay, and whatever supplement or whatever special ingredient that's in that liver detox, the liver also has to detox it. So we do also just need to be mindful that we might be consuming a lot of multivitamins, a lot of whatever, and again, whatever the manufacturer says is potent or clean and healthy and organic and whatever. I mean, our liver still has to process that. So if we're always eating sometimes these processed, man-made, artificial stuff, we could, I'm not saying we are, but we could be also taxing our liver to detox that stuff too. Yeah, so we do need to be a little bit aware. All right. Let's wrap it up. There's one last question. 20 seconds. 20 more seconds. Is that okay? 20 more seconds. I'm going to get kicked off already. We're over time. Raw garlic. I'm just curious. Raw garlic and onion. Can it help the liver? Just a yes or no.
I don't know. I've not heard of this. I'm sorry.
Okay.
I can't help in this case.
Please go and do your research. Be the guinea pig. Test it on yourself. Don't test it on yourself if you've got a liver issue. But if you've got a healthy liver, because we obviously we don't want to do harm. So do get yourself checked out if you really need to get yourself checked out. All right. Okay. I'm getting told to get kicked off. So once again, Dr. Chen Kainar, really appreciate your time, your candidness, your willingness to answer all of these. Like we had Q&A for a really long time today. Thank you so much for your time tonight.
Welcome.
Please leave a great comment and feedback. I'm going to ask you feedback. Please leave great feedback because this was really a very valuable session. And I really hope you guys got a lot out of it as well. So once again, thank you, Dr. Kainar. I will invite you to take your leave now.
Thank you, Gary. Good night, everyone.
Thank you. Have a good evening. And thank you once again for joining us tonight. Until next time.